Hello everyone, I am Dr. Niladri Bhowmick, consultant rheumatologist at Yashoda, Malapet. Today we'll be discussing about rheumatoid arthritis. Arthritis comes from the Greek word arthros, which means the joints, and itis, which means inflammation. So it is the inflammation of the joints. So in arthritis, there is usually underlying inflammation inside the joint or the synovium. Rheumatoid arthritis is one of the most commonly encountered arthritis in our day-to-day practice. So what is rheumatoid arthritis? In rheumatoid arthritis, there is swelling and pain in the small joints as well as the large joints of the hands and feet. All the joints like the joints of the hands, the joints of the feet, the shoulder, elbow, the knee, the wrist can be involved. Usually the distal interphalangeal joints are usually spared in rheumatoid arthritis. The patients of rheumatoid arthritis usually have severe pain in the small joints of the hands, difficulty in movement of the joints, difficulty making a wrist, as well as difficulty in doing the day-to-day activities like walking, and there is severe pain while stepping on the ground. The pain and stiffness is usually maximum in the early morning, and it gradually improves as we keep on doing our activities. Rheumatoid arthritis, occasionally 1 to 2 joints may also be involved, but those are rare circumstances. The rheumatoid arthritis can also involve organs beyond the joints. This happens when it's a long-standing disease or when there has been no treatment of this disease. In lungs, there can be interstitial lung disease, which can cause cough and shortness of breath. There can be involvement of the peripheral nerves or mononeuritis multiplex, which can cause tingling numbness, or it can cause wrist drop or foot drop. There can be dryness in the eyes or dryness in the mouth. There can also be involvement of the skin in the form of the rheumatoid nodule formations. So also it is one thing that is of real big concern is that the rheumatoid arthritis leads to the increase in the cardiovascular diseases, which can cause an increase in the rates of myocardial infarction, that is heart attack, or in strokes. So the diagnosis of rheumatoid arthritis is a clinical as well as laboratory diagnosis. In clinical examination, we can understand the swelling of the joints, which leads to the diagnosis of the arthritis. The diagnosis can be confirmed by rheumatoid factor and anti-CCP positivity, though in 20% of the cases, those two reports might also be negative. One thing to note is that the rheumatoid factor and the anti-CCP levels do not correlate with disease activity, so the levels of rheumatoid factor might rise from 50 to 150 and again come down to 30, but that has nothing to do with the severe activity of rheumatoid arthritis in the patient. Also, a X-ray of the hands and serology in the form of hepatitis B and C is required before a treatment is started. The treatment, we are really lucky that in this age we have multiple treatments available to us. It can involve a short course of steroids, not a prolonged one. Conventionally synthetic DMARDs, which include methotrexate, sulfasalazine, leflunomide. And then if it's still not controlled, we can go for biological agents like TNF inhibitors and rituximab. Also now a revolution has been caused by the introduction of small molecule inhibitors called JAK inhibitors, which can like tofacitinib, which can cause significant improvement in the outcome of the diseases. Treatment needs to be taken till remission occurs and then needs to be continued for some time and should not be discontinued immediately. If you have any of these above symptoms, feel free to contact me at Yashoda, Malapet. Thank you.